Tantor Audio, a division of Recorded Books, presents When a Loved One Won't Seek Mental Health Treatment, How to Promote Recovery and Reclaim Your Family's Well-Being. By C. Alec Pollard, Ph.D., Melanie Van Dyke, Ph.D., Gary Mitchell, LCSW, Heidi J. Pollard, RN, MSN, and Gloria Mathis, Ph.D. Foreword by Gail Steketee, Ph.D. Narrated by Jonathan Sleep. Publisher's note: this audio edition references worksheets and diagrams that can be downloaded at newharbinger.com/53134. This publication is designed to provide accurate and authoritative information in regard to the subject matter covered. It is sold with the understanding that the publisher is not engaged in rendering psychological, financial, legal, or other professional services. If expert assistance or counseling is needed, the services of a competent professional should be sought. Foreword. I'm delighted to see the decades of thoughtful work of Dr. Alec Pollard and his colleagues come to fruition in this book for families whose loved one has been avoiding working on their mental health problems. Dr. Pollard has been a wonderful colleague to many of us clinicians and researchers who work with obsessive-compulsive and related disorders. He is a consummate clinician and outstanding trainer and coordinator of trainings in obsessive-compulsive disorder, OCD, and other mental health problems. Over the years, Pollard and his interdisciplinary team of dedicated collaborators, including Melanie Van Dyke, his wife, Heidi Pollard, Gary Mitchell, and Gloria Mathis, have helped the families of loved ones evading recovery from a variety of mental health conditions. Recognition of the need to help these families developed directly from the team's clinical work. We who work in similar clinical mental health fields understood the challenge all too well, as we received calls from family members seeking referrals and asking how they could convince their loved one to make the call and attend treatment sessions. Family members had done their homework. They knew there were well-established, effective treatments for their relative's condition. Why wouldn't their loved one agree to engage in therapy that would surely help? Understandably, family members were frustrated and often angry that their loved one would not take the basic steps needed to resolve their own problem. Unfortunately, many family members had been accommodating their loved one's unreasonable requests, further worsening the family situation. The effort to find an answer gained steam when Pollard and his colleagues received a competitive grant from the International OCD Foundation to develop and test an intervention program aimed at helping families in this situation. The research that evolved, spearheaded by Dr. Melanie Van Dyke, provided the foundation for development of the family well-being approach and the writing of this important book. The book's definition of recovery avoidance, recurrent failure to explore, pursue, or take advantage of resources and opportunities available for resolving problems or improving health or functioning, captures a range of problems that frustrate family members, including outright denial, insistence that the problem isn't their own, failure to seek help, seeking the wrong kind of help, and/or finding help but not doing the work. What might help ease the family burden and corresponding family conflict over these issues? Pollard and colleagues' family well-being approach arose from decades of effort to help families escape the trap their loved one's recovery avoidance imposes on the family. In this book, they clarify what causes recovery avoidance and offer specific strategies for developing and implementing plans to move forward in these tough family situations. The book is easy to understand, and it lifts the spirit. The language is clear and non-judgmental, spawned from the basic premise that no one wants to have mental health problems or have those problems interfere with their own or their family's enjoyment of life. The step-by-step approach taught in this book is based in well-established ways to influence human behavior. Many examples of family behaviors are offered and expanded in the final section on family stories. Especially important are the very practical descriptions and recommendations for next steps that enable a family member to create a plan and follow it to improve their own and their family's well-being. And the delightfully clear recommendations for obtaining help from professionals are especially useful, given the limited number of clinicians with expertise in either the specific mental health problem the family faces or in helping families versus individual clients/patients deal with such problems. Congratulations to the authors for developing this user-friendly family plan to encourage family self-care and help seeking behavior in reluctant relatives with mental health problems. Gail Steketee, Ph.D., Professor and Dean Emerita, Boston University School of Social Work. Introduction. Olivia paused longer than usual at the door. She didn't want to go inside. She remembered how things used to be when she looked forward to coming home, before her brother Robert changed. She shook her head, opened the door, and walked directly to the designated bathroom, where she undressed and stepped into the shower. Afterward, she put on specially cleaned clothes hung by the shower door. In the kitchen, Olivia's mother was decorating a birthday cake. It was Olivia's 14th birthday, but there would be no big celebration today. No friends would be coming over, because Robert fears they'd bring contamination into the house. Olivia knows her brother has OCD, but she can't help feeling resentful, wondering why she has to sacrifice so much because of his problem. Olivia doesn't have OCD, but she suffers from it nonetheless. And she's not alone. The lives of countless family members are disrupted every day by a loved one's mental illness, including the families we'll be referring to throughout this book. Sarah's husband is severely depressed. He sleeps most of the day and doesn't work, leaving Sarah overwhelmed by the household and financial responsibilities her husband no longer assumes. Vivian, Amy, and Andrew's mother has a hoarding problem. They monitor her safety and spend countless hours cleaning up the clutter and hazardous conditions their mother lives in. Kathy's teenage daughter, Caitlin, has severe social anxiety. Every morning is a major battle as Kathy tries to get her child to school, often late or not at all. Roy's wife, Lynn, worries a lot about the many physical symptoms she experiences. Her quest to find a medical explanation has left Roy overwhelmed with medical bills and his two daughters resentful that Mom's not there for us like she used to be. Rachel, whose husband Sam fears he'll make a mistake that will cause harm to others, is often late to work and sometimes misses appointments altogether because so much of her time is spent reassuring her husband and helping him double-check things around the house. Mental health is truly a family affair. Any disorder, any level of impairment can disturb the family environment, and in many cases, the impact is devastating. The struggles of one family member can compromise the physical, psychological, social, and financial stability of the entire family. For most families, hope rests on the promise of treatment, and there's good reason to have hope. Evidence-based psychotherapies, medication, or some combination of both have helped millions of individuals recapture their lives and those of their families as well. On top of that, promising new therapies are being investigated every day. There's just one problem. Even the best treatment doesn't work if it's never received. In fact, at least half the people suffering from mental and emotional disorders don't receive the help they need. Some lack access. But even when effective treatment's available, there are many who refuse to go, promise to go but never do, or show up but never really participate. As you'll learn, these folks are what we call recovery avoiders. We use this term to highlight the effect of a person's behavior, not their intention. Recovery avoiders don't set out to become disabled, nor do they intend to disrupt their families' lives. Recovery avoidance simply describes a pattern of behavior that's incompatible with recovery. There are real reasons your loved one avoids recovery, like misinformed beliefs, skill deficits, competing incentives, and deficiencies in motivation, but none involve a desire or decision to remain impaired. We'll explore the causes of recovery avoidance more in Chapter 1. Regardless of what's behind the behavior, recovery avoidance presents another layer of burden for families. Without hope of treatment, there's little reason to expect things to improve. It's natural to feel disheartened about the future when you're in a situation like this, To feel resentment and anger when someone you love appears to be doing nothing about a problem that's causing so much distress for everyone involved. And when family members feel it's their responsibility to save their loved one, they endure the added burden of guilt over what they unjustifiably perceive as their own failure. Caring for someone who's experiencing mental health difficulties can be hard enough, but it's even harder when the person you love is avoiding recovery. Whether it's your son, daughter, partner, spouse, parent, or other family member, when a loved one avoids recovery and doesn't do the things you believe could improve their quality of life, it's hard not to lose hope. And when your well-being is tethered to someone else's behavior, someone who's unwilling or unable to change, you're likely to feel trapped. That's the fundamental dilemma of families grappling with recovery avoidance. They're stuck in what we call the family trap, because their hope for the future rests largely on another person's behavior. And despite multiple failed attempts to change that person, families keep trying the same tactics over and over with little or nothing to show for it. They know it's not working, but they don't know what else to do. They're stuck. The family's futile quest for help. Those stuck in the family trap need help, but there's no one there to provide it. Some families reach out to a clinician, but unfortunately that doesn't always go so well, like when Sarah tried to get help for her depressed husband. Sarah: my husband's severely depressed. He really needs help. Dr. Typical: is there a reason your husband didn't call me himself? Sarah: he doesn't believe treatment will help. He says it's a waste of time. But he doesn't leave the house and rarely gets out of bed. Dr. Typical: sounds like he's depressed all right, but there's nothing I can do unless he wants help. Sarah: so that's it? You won't help us? Dr. Typical: I'm sorry, but have your husband call me if he changes his mind. Sadly, Sarah's experience is typical, and before we as therapists ourselves started working with families, we were much like Dr. Typical. After all, therapists know they're not magicians. How can they treat a person who doesn't want help? Even if Sarah pressured her husband into therapy, working with a coerced patient is usually unpleasant and almost always unproductive. Still, there's something Dr. Typical could have done to be more helpful. The mistake was not refusing to treat the person who didn't want help. It was ignoring the person who did. Rethinking how to help families. It never felt right to leave families in such an untenable position, but for a long time we simply didn't realize there was anything else to be done. We thought our sole responsibility was to treat the person with a mental health problem, and if they weren't receptive, there was no other option. Sure, we routinely included families in treatment sessions, but the identified patient was present, and their disorder was the primary focus. It never occurred to us to conduct therapy without the patient, instead focusing on the rest of the family. We were as stuck in our way of thinking as those families were stuck in recovery avoidance. Eventually, our view of the problem changed. Families taught us how to understand their dilemma. They shared their daily struggles, how they felt abandoned by healthcare professionals and blamed for their loved one's failure to recover. We realized the magnitude of disruption so many families experience. If our job is to treat mental illness, shouldn't that include all who suffer? Other family members were struggling. They deserved our help too. At the very least, we could teach families how to lessen the impact of recovery avoidance on their own lives. We also recognized that our knowledge of motivation was being used only to decide who not to help. Like most traditional therapists, we knew the futility of treating an individual who isn't motivated to change. That part of our clinical judgment was reasonable, but we were ignoring those motivated family members. Unlike the recovery avoider, they wanted help. Finally, we realized that certain family interactions are more than just ineffective. Sometimes they make things worse. Families don't cause mental illness, but they can influence the course of a disorder. We knew from clinical observation and subsequently from emerging research that certain family patterns are associated with more severe impairment and poorer response to treatment. By not providing guidance to these families, we were failing to give them the opportunity to create a family environment that better facilitates recovery. As we adopted this new perspective, we began exploring ways to help families. In the early 1990s, there were no manuals or workbooks on this topic, but there were resources to draw on. We investigated how recovery avoidance was addressed in the field of alcohol and drug dependence, and we recognized some of those concepts and interventions might be helpful for the families we were seeing. We studied family systems theory, which helped us understand how families become locked into patterns of dysfunctional behavior and how we might help unlock those patterns. We were also heavily influenced by cognitive behavior therapy, CBT, a type of psychotherapy successfully applied to a variety of problems involving anxiety, depression, guilt, and anger, the very emotions that can hinder families trying to escape the family trap. Additionally, CBT provides effective strategies to generate behavior change, a crucial ingredient for achieving family well-being. This book is the culmination of 3 decades of work by the Family Consultation Team at St. Louis Behavioral Medicine Institute and St. Louis University School of Medicine. It describes a new approach to recovery avoidance, one that promises hope for the many families struggling to escape the family trap. About this book. The method described in this book is called the Family Well-Being Approach. As you'll discover, our approach prioritizes the emotional health of the entire family. Promoting family well-being is critical because most people stuck in the family trap are trying to help their loved one understand suboptimal conditions while living in a distressed family environment. That's a big reason they continue to struggle. It's like trying to tread water with an anvil strapped to your back. In this book, we'll help you remove the anvil. That means learning how to ease distress within your family and knowing why it's so important to do so. It means learning how to reverse recovery avoidance and get your loved one on the path to functioning better. But first, it means becoming emotionally and strategically prepared to do all of this effectively. We'll help you help your loved one. But as we've learned, that rarely happens when the welfare of the rest of the family is overlooked. First things first. Who might benefit from this book? It was the plight of families grappling with untreated OCD that first captured our attention, but we soon realized the interventions we were using could benefit families dealing with a variety of conditions. Over the years, we've helped the families of individuals diagnosed with panic disorder, agoraphobia, social anxiety disorder, generalized anxiety disorder, separation anxiety disorder, post-traumatic stress disorder, major depression, body dysmorphic disorder, illness anxiety disorder, borderline personality disorder, hoarding disorder, and various eating disorders. In many cases, the family's loved one had received multiple diagnoses. We've not tested our method with every possible disorder. However, the potential benefit of our approach may have more to do with the nature of the family situation than the specific disorder involved. The families we've helped have had 5 characteristics in common. Someone in the family was behaviorally impaired by a mental disorder. The loved one with the disorder was a recovery avoider. The loved one's state of impairment created distress or disruption in the lives of other family members. The family's efforts to change the loved one had failed. At least one family member was willing to try a new approach. If these characteristics describe your family situation, please continue listening. How the book is organized. The book is organized into 2 main parts that tell you what you need to know, Part 1, and what you need to do, Part 2, to improve your family's well-being. Part 1. The Family Trap, What You Need to Know. Here we describe the dilemmas that families face when dealing with a loved one who doesn't seek recovery. In Chapter 1, we discuss the concept of recovery avoidance and explain why some people act in ways inconsistent with recovery. Chapter 2 describes the way in which families naturally respond when someone they care about is a recovery avoider. We introduce the concepts of accommodation and minimization, 2 common but counterproductive forms of family behavior that can make recovery avoidance worse, and we describe how accommodation, minimization, and recovery avoidance interact to create the family trap. In Chapter 3, we describe a way out of the trap, the family well-being approach. Chapter 4 alerts you to common obstacles you might encounter as you follow the steps outlined in Part 2 and suggest ways to overcome those obstacles. Part 2, Escaping the Family Trap, What You Need to Do. In this part, we describe the 5 steps of pursuing family well-being using the family well-being approach. Step 1, Chapters 5 and 6, help you anticipate and plan for potential crises, in particular, the troublesome and potential dangerous ways your loved one might resist the changes you plan to make. Step 2 helps you identify areas of your life that have been negatively affected by your loved one's condition, Chapter 7. It also assists you to prioritize the changes you most want to make, Chapter 8. Step 3 is for family members who, in dealing with recovery avoidance, have abandoned activities they value. Chapter 9 and 10 are designed to help you get those activities back into your life. Step 4, Chapters 11 and 12, is for families who want to ease family distress and improve the quality of interactions with their loved one. This step helps you organize and implement a plan to replace counterproductive behavior with more effective approaches to recovery avoidance. Step 5, Chapters 13 and 14, teaches you how to promote healthy behavior in your loved one. You'll learn strategies that discourage recovery avoidance and encourage recovery behavior while avoiding power struggles. Additional materials. The final chapter, Chapter 15, outlines 3 additional steps you may need to consider beyond the 5 main steps of the family well-being approach. Specifically, it helps you decide when it's necessary to remove a foundational accommodation, an accommodation your loved one depends on as a basic necessity like food or shelter, whether and how to get professional consultation, and the extent to which you should plan for the road ahead to safeguard the future of your loved one and the family as a whole. The section at the end, Family Stories, provides information on each of the 6 families we feature in this book. Throughout the book, we'll refer to online resources, newharbinger.com/53134, where you can access worksheets and other information relative to achieving family well-being. A few cautions before you begin. Before moving on to Chapter 1, 3 cautions. First, please don't skip steps that might be valuable to you. Doing so could jeopardize your preparation for subsequent steps. The main reason families remain entangled in the web of recovery avoidance is not that they don't know what to do, but that they act before they are emotionally and strategically prepared. Each family will need steps 1 and 2. For steps 3 through 5, use the pre-check at the beginning of each step to help you determine whether that step is relevant to your situation. Second, keep in mind our book isn't a substitute for professional guidance. Some families may be able to use this book successfully on their own, but others will benefit from additional assistance. We discuss the prospect of working with a professional in Chapter 15. However, if at any point you feel discouraged or stuck in your efforts to improve your family's well-being, please consult a licensed mental health professional. Our book can help guide your therapist's efforts to assist you. Finally, tension in families dealing with recovery avoidance can easily escalate and in some cases endanger family members. The family well-being approach looks at the big picture, the long-term consequences of grappling with recovery avoidance, and how to free yourself from counterproductive family interactions. Helping you anticipate potential crises is part of our approach, but it isn't addressed until Chapters 5 and 6. If an incident arises before then, please take whatever action you feel is necessary to ensure your family's safety and welfare. Moving forward. In Chapter 1, we'll dive deeper into the nature of recovery avoidance, what it is, why it happens, and what perpetuates it. From there, we'll begin to explore how you might help your loved one and your whole family turn things around. We hope you find this book helpful, and we wish you all the best as you seek to improve your family's well-being. Part 1. The Family Trap, What You Need to Know. In Part 1, you'll learn what's happened to your family and why. The concepts and principles you'll learn in Part 1 provide the groundwork you need to advance to Part 2, where you'll learn what you need to do to improve your family's well-being. Chapter 1: The Nature of Recovery Avoidance. Main point. In this chapter, you'll learn the meaning of recovery avoidance and the reasons people behave in ways that are incompatible with recovery. It's common for people to behave in ways inconsistent with their self-interest. Most of us have struggled to follow a healthy diet, exercise regularly, drop a bad habit, or get the proper amount of sleep. And flossing your teeth daily? Not even a third of us do that. Human behavior is not always rational, healthy, or constructive. What's more, self-improvement typically means adopting new behavior, which sometimes involves more work, discomfort, or inconvenience than we're willing to tolerate. Redirecting behavior in a healthy direction can be hard for anyone, and especially difficult for someone dealing with mental illness, a challenge no one chooses to have. Keep these points in mind. It will help you better understand recovery avoidance and optimize empathy for the loved one whose condition prompted you to listen to this book. Defining recovery avoidance. Recovery is the process of gaining a better emotional or physical state of health or functioning. Avoidance is the act of keeping away from something. If we put these concepts together, recovery avoidance can be defined as the act of keeping away from a process that will lead to improved health or functioning. A complete definition, however, should include 2 additional points. First, recovery avoidance is a pattern of behavior that develops over time, not a momentary lapse. Second, recovery avoidance is more than the absence of improvement. It's active failure to take advantage of resources and opportunities that could lead to improvement. Therefore, we define recovery avoidance as recurrent failure to explore, pursue, or take advantage of resources and opportunities available for resolving problems or improving health or functioning. Ultimately, a person can avoid any aspect of health or well-being. In this book, our focus is on those who avoid recovery from psychiatric and behavioral impairment, something we first wrote about over 2 decades ago. Recovery avoidance can be expressed in a variety of ways. Some people deny having a problem. Others acknowledge a problem but insist it's not psychiatric. Some acknowledge having a psychiatric disorder but never seek help. Others continually seek the wrong kind of help, and some find the right help, perhaps at the insistence of others, but sadly, never seem to take advantage of it. In each of these examples of recovery avoidance, the individual's behavior is incompatible with the pursuit of recovery. How does the loved one in your life express recovery avoidance? Take a moment to think about this before you continue listening. Common misconceptions about recovery avoidance. It's natural to wonder why anyone wouldn't do everything possible to overcome a problem, especially one associated with significant suffering. Family members, understandably frustrated with the situation, sometimes think of recovery avoidance as their loved one's willful choice to be impaired. They may view their loved one as lazy, unmotivated, selfish, spoiled, or oppositional. If you've ever felt this way about someone in your family, it's understandable, especially if you've had no other way to make sense of their behavior. But be careful. Negative labels tell us nothing about why someone avoids recovery, much less what to do about it. More important, this kind of negative judgment can fuel your anger and compel you to interact with your loved one in counterproductive ways. Fortunately, the science of human behavior offers a much more useful way to understand recovery avoidance. The real reasons people avoid recovery. 4 factors can contribute to recovery avoidance: recovery interfering beliefs, skill deficits, motivation deficits, and incentive deficits. In the sections that follow, we'll dive into each factor. As you listen, keep in mind, we're not talking about what causes an individual's psychiatric disorder, since everyone with a mental illness isn't a recovery avoider. We're talking specifically about factors that underlie recovery avoidance. Recovery interfering beliefs. Beliefs affect behavior, and certain beliefs get in the way of recovery. For example, people who believe they don't have a problem or that their condition is untreatable are unlikely to seek professional help. When strongly held beliefs like this become highly rigid, they're called overvalued ideation. People with overvalued ideation are particularly vulnerable to recovery avoidance. They may be perfectly reasonable in other areas of their life, but when you attempt...
Sample complete. Ready to continue?